Greetings, everyone. I am welcoming you on behalf of the League of Women Voters of Oregon. I am Becky Gladstone, the State League President. The League is dedicated to making democracy work. One of our core beliefs is that democracy functions best when citizens are informed about issues and engaged in their communities. As part of fulfilling that mission, the League studies issues and shares what we learn with Oregonians. We studied childcare in 1988. We recently updated that report entitled Caring for Our Children. This program is a chance to hear from experts in childcare. The presentation is being recorded and will be available on our website, LWVOR.org. Let's see. Now I'd like to introduce our moderator, Terry Styner. Terry is a member of the Washington County unit of the League and was a member of the study committee. Thank you, Terry.
Thank you, Becky. And thank you to all of us who are joining us tonight. As Becky mentioned, the League recently completed an update about the state of childcare across Oregon and the impact, the ability or lack thereof that affordable childcare can have on the workforce. As Becky mentioned, the original study was completed in 1988. While there has been much progress in terms of policy support at the state level, our update showed that there is still much work to be done. The pandemic has revealed that our economy is affected, for better or worse, by availability and affordability of childcare for children from birth to high school. The purpose of tonight's panel is to provide information to you, our audience, about the current state of childcare for both preschool and school-aged children in the state of Oregon. Tonight, we will hear from 4 panelists, all of whom are considered experts in understanding the needs of families. Each panelist will have 10 minutes to share their perspective on the challenges and opportunities for the childcare environment. You may use the Q&A function on your screen to ask questions. Kathleen Hirsch, chair of the Washington County unit and lead for the study, will gather your questions and share them with our presenters after all have spoken. So please indicate to whom your question is directed. Let's get started. Our first speaker will cover the many reasons we need quality, affordable childcare. Martha Brooks is Oregon State Director, Western Region State's Regional Director for the Council for a Strong America, an umbrella for several nonprofit organizations whose members are senior law enforcement officials and business leaders who work to improve policy and advocate for federal funding in key issues such as pre-K, after-school, and out-of-school time programs, child abuse, neglect, and prevention, and of course, childcare. For the past 18 years, Martha has overseen operations in Oregon, Montana, and Wyoming. She has served on the Oregon Early Learning Council, the Oregon Youth Development Council, and was a member of the Washington County Commission on Children and Families. She is the recipient of the National Donna Stone Leadership Award from Prevent Child Abuse America, in recognition of her many years of advocacy for children. Martha, welcome.
Thank you, and good evening, everyone. Thank you, Becky and Terry, and thank you to the League of Women Voters for the invitation to participate. I'm here, as all of us on the panel are, to talk about the importance of families having access to affordable quality childcare, which is a challenge that many of us have felt personally at some point in our lives. As the state director for Fight Crime, Invest in Kids and ReadyNation, I can tell you both organizations are extremely interested in childcare. Our members know making sure young children have supportive, nurturing environments have been proven to be essential in building kids' ability to succeed in school and life. Working with Fight Crime, Invest in Kids and ReadyNation, I've become very familiar with the positive evidence-based effects that quality early childhood programs can create, including a better chance at being prepared for kindergarten and ultimately graduating from high school on time, as well as a reduced likelihood of getting mixed up in the criminal justice system. Our new ReadyNation National Childcare Report, $122 billion, the growing annual cost of the infant-toddler childcare crisis, released February 2nd, highlights some of the economic challenges to quality childcare. Let's take a look. But first, I want to mention that this report has received a ton of media. In the first 4 weeks, we had over 900 media hits and hits in all 50 states. The new report is an update of our 2019 report that found that infant-toddler childcare crisis costs our national economy billions each year due to the lost productivity, revenue, and earnings. The new report found things have gotten much worse, in part due to the burden the pandemic placed on an already fragile childcare infrastructure. For both studies, we hired a survey firm. They surveyed a nationally representative sample of more than 800 parents, both mothers and fathers, of children under age 3. The new study was conducted in December of 2022. Survey questions asked parents about their problems with childcare and the impact on their work lives. Parents reported several problems that they face. The next 4 slides present the questions asked in the survey and the percentage of parents reporting the work problems caused by childcare challenges. For lower productivity, the questions focused on being late for work, leaving work early, missing a full day or part day of work, or being distracted at work. You can see the percentages of parents reporting each of these problems was about half to almost 2/3. For time at work, we asked about work hours being reduced, either voluntarily or involuntarily, and changing from full-time to part-time work. More than 1/3 of parents reported each of these problems. For work disruptions, we asked about being reprimanded by a supervisor, having to quit a job, being let go or fired, or being demoted. Here we found about 20 to 30% of parents reporting these problems. Finally, we asked about problems that could impact career pathways, such as turning down a new job or a promotion, or education and training, or having problems participating in education or training. Here we saw more than 1/4 to almost half reporting these problems. Once we collected the survey data, we hired an economist to take that data and model the economic impacts of these work problems caused by childcare challenges. So what did we find? In 2018, we found the infant-toddler childcare crisis had a negative economic impact of $57 billion each year due to lost productivity, revenue, and earnings. Our new study found the impact has more than doubled to $122 billion every year due to this same crisis. In Oregon, the crisis drains an estimated $1.4 billion from our economy, which significantly harms working parents' income and job opportunities, as well as the stability of the workforce. That's up from $674 million from 4 years ago. It is important to note this staggering figure underestimates the impact of insufficient childcare overall. Our reports only calculate the damage caused by a lack of care for children younger than 3 who need childcare. The economic costs climb significantly higher if we were to include children who are in childcare age 3 and beyond. 60% of Oregonians currently live in a childcare desert, meaning there are more than 3 children under age 5 for every licensed childcare slot. And all 36 Oregon counties are in an infant and toddler childcare desert. The annual cost of center care-based childcare for infants and toddlers is higher than in-state public college tuition in 34 states, including Oregon. The average cost for full-time center-based infant toddler childcare in Oregon in 2021 was nearly $16,000. The cost of annual in-state college tuition was approximately $13,600 at, say, Oregon, Oregon State, or Portland State. These economic impacts accrued to parents, employers, and taxpayers. Almost 3/4 of parents surveyed called childcare access a challenge. Overall, the report estimates that infant-toddler childcare challenges cost families an annual average of $5,520 per working parent in lost earnings and in time spent looking for work. for a total across all parents of children under age 3 of $78 billion. These challenges cost businesses an average of $1,640 per working parent in reduced revenue and in extra hiring costs, for a total of $23 billion. Finally, taxpayers also suffer consequences as our tax base loses $1,470 per working parent in lower federal income and tax revenue, for a total of $21 billion. Again, these are annual costs and only costs for infants and toddlers. These economic impacts harm parents, employers, and taxpayers. The costs of parents are in the form of lost wages due to lower productivity, less time in the workforce, and disruptions like quitting or being fired or let go. Parents also lose future income due to diminished career prospects. 54% said they've been late for work or left early because of childcare problems in the previous 3 months. 1/3 said they had to switch from full-time to part-time work. About a quarter of parents said they had either quit a job, been let go, or been fired due to childcare struggles. Employers' costs result from lower productivity and extra expenses related to rehiring. Employers also incur future costs due to lower workforce capital. Tax revenue is lost both currently and in the future due to parents' lower incomes and less compensation of taxable goods and services, as well as lower business revenue. Why do we see this increased economic burden due to the infant-toddler childcare crisis? This chart is too small to read, and I apologize, but it is in the report. But the black represents 2018 and the green 2022. You can see from almost each impact, the bar is longer for 2022, representing more parents reporting the problems. Childcare problems reported by parents in 2022 were both more widespread and more severe than 2018. Severe problems increased substantially. For example, the number of parents reporting quitting a job due to childcare challenges doubled, and 3 times more parents reported being let go or fired. The reasons for these increased impacts are basically COVID and insufficient policy action. The already fragile pre-pandemic childcare industry was decimated by COVID, with providers closing, many temporarily and significant number permanently, making the situation far worse now and costing our economy billions more. The childcare workforce is now 5.5% smaller than it was pre-pandemic. That's nearly 58,000 fewer childcare providers nationwide. You can see that in the graph here. It can be worse in rural areas where there are, or may be, few to no providers, especially for infants and toddlers. Where does all this leave us? Based on the challenges I described, it's reasonable to project this already enormous amount of annual economic damage will grow and continue to grow. All of this to say is that state and federal investments focused on the childcare crisis that allow more working parents to access affordable quality childcare is not only critically important to building a strong next generation of Oregonians, but it's also critical to helping working parents and businesses today, both here and across the nation. The report and the fact sheet links will be placed in the chat. Thank you, Abby, and thank you, everyone.
Thank you, Martha. Really important information to share. Thank you. Our next speaker is Julie Hurley. Julie is co-leader of the Childcare Coalition of Douglas County and executive director of early learning in the Douglas Educational Services District. Julie has responsibility for the continued growth and success of the early learning teams housed at the ESD and providing consistent ongoing support to the early learning administrators. She began her early learning professional career in 2017, focusing on parent education and creating awareness with local business leaders about the importance of family-friendly work practices and support of early childhood learning. Since 2020, Julie has been a co-lead of the Douglas County Child Care Coalition, with a focus on helping local childcare programs stay open, thrive, and grow. Welcome, Julie.
Thank you. And thank you to the League for inviting me to speak on the work that we have been doing in Douglas County. My name is Julie Hurley, and I work at, as she said, Douglas ESD. My co-lead in the Douglas County Child Care Coalition is Heather Frellinger. She is our program coordinator of our local child care resource and referral group, but she was unable to make it tonight, but she's been a key role here. And so I'm going to start off with kind of a strange question, but what do foresters do to encourage growth of a healthy tree? And what does that have to do with early childhood education? Well, we are fortunate to have Jake Gibbs from Lone Rock Resources as one of our members on our Child Care Coalition. And I've shared a quote on the screen from him, kind of linking how they, as professional foresters, really front end load their work with young seedlings in the very early years, in those 0 to 4 years, because they know and can envision that healthy forest in the future. And he correlates this to our children needing and deserving that same early investment and commitment to have a chance to realize their potential. Like the young trees that they have multiple experts engage and support them, that's what our young children and families need as well. So as we know, an investment in early childhood education is really the upstream solution. The highest rate of return in early childhood development comes from investing as early as possible, from birth through age 5. And this upstream solution really is creatively addressing a problem at its source. 0 to 5 is a critical time in a child's development. The brain is developing rapidly, both cognitively and social emotionally. And these skills they develop in these young years are really necessary later for success. And we see this in multiple countries, both the developed and underdeveloped countries. So the greatest productivity of investment comes in these early years. And we're not saying that there's no benefit to the K through 12 or post-secondary investment, but similar to a tree, if you invest its base as a seedling, you will see more return later in life. And so what is that return on investment? As you can see, children perform better in school. They're less likely to commit a crime. They're more likely to pursue post-secondary education or go on to a trade school. They're more likely to be self-sufficient and earning more. And overall, they're healthier physically. And here's some research and analysis that we did as we started our Child Care Coalition, and work that we have continued to look at, and research that we've continued to look at. So we determined that Douglas County lacked almost 500 infant, toddler, and preschool childcare slots, and around 145 after school openings when we did this original analysis in early 2021. And we know licensed childcare costs is averaging about $600 to $1,200 a month for full-time care in our county. And then through the research from through research done in May of 2021, 84% of working parents need full-time care 5 days each week. And continuing with that research, we looked at seeing the family care benefits rose in importance from 52% prior to the pandemic to over 70% in 2022. And that 83% of millennials would leave one job for another for stronger family policies and supports. And then similar employers lost about $13 billion annually in productivity costs due to childcare challenges. So the result, when employees can't access childcare, the employer's costs increase, absenteeism goes up, productivity goes down, and it's harder to hire and maintain a workforce. So our business leaders in Douglas County realized the importance of this and came to the table, and organically the Douglas County Child Care Coalition was formed. So as we said, our goal has been helping providers stay open, thrive, and grow. We are a childcare desert, meaning that there are not enough slots to meet even basic demand. Our coalition was established in September 2020, really because of the lack of childcare during COVID-19. And because of the work that we had been doing as an agency, reaching out to businesses around family-friendly practices, creating awareness about the importance of early learning, business leaders came to us saying, we want to be part of the solution. And so the mission is really to increase the quantity, quality, and accessibility of local childcare. And when we talk about local childcare, we're a large county geographically, not by numbers, but how do we get it out in the areas outside of our largest town of Roseburg? How do we get to Glendale and Glide and Drain? And so we set a goal, and that goal was to increase childcare capacity by 30%, which would include opening 150 new infant, toddler, preschool slots and 50 new after-school slots for K through 5th graders by 2024. So who's at the table in our coalition? Well, of course, it's early learning and system professionals. It's childcare providers themselves. It's business services. It's employers. It's our workforce development teams. It's our education, including our K through 12, as well as our local community college, Umpqua Community College. It's government officials, both from the county and varying cities. It's a faith-based community. It's just community members. And we're lucky to have several foundation funders at the table with us. So we all know there's a lot of challenges to the childcare system. So that's what we knew. And we knew that things like the business model, things around zoning and building codes and licensing really made it hard to open and expand a childcare program. And like many childcare providers, have a hard time attracting and retaining workforce. And the increased wages that they were trying to pay early childhood educators actually affects the affordability, and that cost is put to the parents. So what did the coalition do? We had some very targeted actions. We wanted to focus on these 4 buckets of work. First one being business support. How could we help our local childcare providers of all types and sizes with technology, with support with grant writing, anything they needed to more efficiently run their business. And our primary focus was in workforce, because we know that until we have a workforce of early childhood professionals and educators, that we wouldn't be able to open these slots. So we developed scenarios, I think 3 or 4 scenarios, to help determine how to get to the 150 slots for the infant toddlers. And we realized on average, we needed to recruit around 25 people to come into the profession. And then we also needed to help focus on an infrastructure for these programs that were open or wanting to open. How do we help make sure we could support them in navigating their licenses, things that maybe our local government had put in place that maybe made it more challenging. And we wanted to also help with how can we help improve the sites they're at, help connecting them to resources. So for example, we had an individual who had purchased a I think an old church, but she needed to make some improvements. So we were able to connect her to one of our local engineering firms who volunteered their time to go in and do a review for her. And then last and probably most important is continuing to increase the awareness of how childcare is fundamental and impacts all of us, and how could we advocate at legislation and do that, get that reach out there. So we've had a lot of accomplishments to date. So I actually have three slides of accomplishments. We listened to parents and childcare providers. We did that through surveys and listening sessions. And based on the various state grants that childcare providers were receiving through the pandemic, they asked, we need support with tax planning. So we actually had 2 CPAs volunteer to host free sessions with our providers. And so that was exciting. We're able to kind of connect them to services they need. And wanting to have an immediate action, the coalition really focused on getting much needed supplies directly to our providers. So we distributed in our first distribution over 800 rolls of paper towels, almost 25,000 paper plates and bowls, 80 gallons of bleach, and 50 bottles of disinfectant sprays. And I'll tell you, too many pencils, pens, markers, crayons, and other school supplies to count. But the most coveted item we gave out was sanitizing wipes, and we were able to distribute around 100 packages. And many of the providers who came through our first distribution event were asking, where did you get these? We can't find them on the shelves. So that was exciting that we were able to give them something they couldn't find. Additionally, we gave out Wi-Fi boosters, surge protectors, headphones, and trifold things that to any provider supporting children who were doing distance learning at the time. And we finally were able to give out germ fogger sprayers. We purchased those, and these really helped to reduce the amount of time programs were spending on disinfecting their room. And we were able to do this really through funding from our county commissioners and our Roseburg City Care Acts funding, and donations from private community members. And last, we did focus on workforce, as I said earlier. And so to date, we've been able to give out around 16 incentives that were aimed at hiring incentives, retention incentives. And so we've had 4 new license programs expand or open new childcare sites. We've been able to open 58 new childcare early learning slots for Douglas County. And we also were able to support 105 continuing childcare and early learning slots. So help these programs who had lost staff kind of bring them back into their classrooms. And then last but not least, as I said earlier, is awareness campaign that we are currently developing called Childcare is Fundamental. And we have a website we're developing called childcareis.org. And I think one of the wins we've had through all the work we've done is that our childcare providers and the staff felt seen and recognized as frontline responders. Many have reached out to us just thanking us for the support. And late last year, we actually did an appreciation day for them. We gave them self-care things, desserts for their staff, just something to recognize them for stepping up, coming back on board, and really helping the workforce of today and developing the workforce of tomorrow. And because we have a big focus on how employers can get involved with early learning and how their family-friendly work practices that they put in place, we really do focus on how employers can help and how they can help across the board, not only with childcare and helping increase that in our community, but other ways that they can get involved with just supporting early learning programs across the board. So we've done some very exciting work, and we're continuing to go coming up on 3 years. So it's exciting work, and our team is very engaged in wanting to move forward. So we're excited for what we're going to see over the next year. And thank you so much for the time to share what we've done in Douglas County.
Thank you, Julie. It sounds like there's some really impactful stuff going on and with a lot of good community involvement. So thank you for that.
Welcome.
Our third speaker is David Mandell. David is the Chief of Policy and Research at the Early Learning Division at the Oregon Department of Education. He has been with the Early Learning Division since 2014. Prior to working for the state, David served as the Policy and Research Director for the Children's Institute. Welcome, David.
Well, thank you for having me here today. Can folks see my screen okay?
Yes.
Great, thank you. So I think I was invited to talk about the prospects and for the Department of Early Learning and Care. So just to provide a little bit of background, currently most of the work, the state level work around early learning flows through the Early Learning Division, which is currently a subdivision of the Oregon Department of Education. During the 2021 session, the legislature passed House Bill 3073, which creates the Department of Early Learning and Care as a standalone state agency. And we will become that standalone state agency effective July 1st of this year. I think we're now officially at the 100-day countdown point to the launch of the Department of Early Learning and Care. And I think the legislature's reasoning behind creating the Department of Early Learning and Care was for exactly a lot of the things that you've been hearing from my fellow panelists tonight, right? The challenges across the state and parents accessing childcare, finding high quality, affordable early learning programs that meet their needs. And I think it was the belief of the legislature that having a state agency, an agency level organization would help Oregon move to a unified and strengthened approach to addressing these challenges. So I think, the ultimate goal of the Early Learning Division, and part of what we've been doing over the last a year and a half, is also listening to childcare providers, listening to parents, listening to community partners on what their expectations are for the Department of Early Learning and Care. And so this is the mission in front of you, that we really be there to foster coordinated, culturally appropriate, family-centered services that recognize and respect the need of all children, families, and early learning and care professionals. So I think so 2 questions that, what will families and providers experience differently on July 1st? And I think our frank answer is that for July 1st, we really hope that families and childcare providers really don't experience much different on that particular date. We really want to make sure that there's a continuity of services, that childcare providers continue to get paid, that families still are able to find the resources that they need on that day. So I think a lot of what I will be sharing with you in a little bit is really what's that sort of prospect for the future. And I think what we're hoping that having this new unified state agency will really make possible going forward. This is just a little bit, to give us sort of an orientation of what we're sort of talking about in terms of the scope of the work. It's about 230,000 children in Oregon under the age of 5. And of course, as the name Department of Learning and Care suggests, a lot of the focus is really on that birth to 5 population. We also work to support school age care with children up to age 12. nearly 70,000 publicly funded early learning slots in Oregon. We will be working with about 3,000 childcare providers who serve families through employment-related daycare, and I'll talk more about that. And licensed programs with a capacity to serve about 104,000 children. Again, that's up through age 12 for school-age care. This is a slide that we always like to show to really sort of, I think, help people imagine what is the world, the universe that we're talking about when we talk about early learning and care. Because I think it's really important I think sometimes when we're talking to folks about early learning, the image might be for K through 12 and schools and school buildings, right? And that is part of the world of early learning. That's where, many schools, districts run preschool programs, and we partner with school districts on that. But we're also talking about programs that are Head Start programs that are run through community-based organizations, mom and pop childcare providers. Also, lots of our childcare is provided within a person's home, so lots of family childcare. And I think part of the mission of the Department of Early Learning and Care is really to both recognize the diversity of those settings, that diversity is really important to families, because families have different needs. It's really important to communities, because communities have different assets and needs as well, and that we want to support early learning and care, whatever of those settings that a parent may choose, and that quality care can happen in all of those settings. And our goal is really to be thinking and working really closely across this full range of what sometimes gets called the mixed delivery system, although I think that word doesn't really sort of capture fully the diversity of what we're talking about. Before I move into talking a little bit more about what actually will be the function of the Department of Early Learning and Care and our role in the system, wanted to share a little bit of data with you that we're seeing at the moment. This is some data on the number of licensed child care facilities and our licensed childcare capacity. This data doesn't tell the full story, and I'll get to that in a minute, but I do think this is also a really important sort of piece of information of where we sort of are in the state right now. So this is looking at on the left, the number of facilities pre-pandemic and post-pandemic, and you can really see that real dip, both particularly in the number of facilities in the state and particularly in the licensed capacity during the pandemic. But you can also see that when you're just looking at the sort of number of facilities, but even more so when you're looking at licensed capacity, I think that during the height of the pandemic, I don't think we would have thought we were going to see this return to the pure number of facilities. And I think a major part of that story is all of the federal dollars that came to states to get to childcare providers to help them get through the pandemic. So I think, and this breaks it down a little bit by type. So when you look at it, what you'll see is that in terms of the licensed capacity for centers and our large family childcare, we've actually starting to see a little bit of an increase. We've seen some reduction in our smaller family childcare providers, although that trend was sort of in place even before the pandemic. What I want to say, though, about these numbers, this is really not the full story, right? I think, as everyone has said, who spoke before me, we did not have enough childcare before the pandemic. We still don't have enough childcare. And what these numbers are showing you is the licensed capacity, right? Of if a program is fully open to its legal limit, how many children can a program serve? So I think the good news is, in terms of the pure number of facilities, we didn't lose as many facilities during the pandemic. But what we're also seeing, and I go back to some of the numbers that Martha Brooks shared with you earlier, is that the workforce has not returned to its pre-pandemic levels. So what we're hearing from childcare providers across the state is how challenging it is to find new employees, hire them, bring them on, and keep them. So I think a lot of the real challenges that families are experiencing go back to the real challenges that we, saw before the pandemic, but have really been exacerbated by the pandemic around the childcare workforce. I'll skip ahead a little bit for a second for another slide. We sort of think about the diversity of the work. So one of the great strengths of the childcare workforce, extremely diverse, both in terms of demographic diversity, language, but we also know that this is a workforce that has been historically underpaid, for the most part, really receiving close to poverty wages. And, I think that explains one of the really most important parts of the story, the incredibly high turnover in the early learning workforce. We lose about a quarter of the workforce every year. As I think has been discussed earlier, when you get to infants and toddlers, every county in the state is a childcare desert. The story looks better for 3 and 4-year-olds, but part of that story is that if you took out the publicly funded slots for 3 and 4-year-olds, every county in Oregon would also be a childcare desert for 3 and 4-year-olds. And I think if you go to, and I will go back to my previous slide, I'll go back to my original order, you'll see that, historically, it's really in infants and toddlers, where I should say historically, early childhood in this country has been underinvested, but where there has been investments, it's tended to be the slightly older children. And so we see that it's really in infant and toddlers. We have our lowest level of public investment. And I think that also correlates with that not only being the most expensive kind of care, but the care that families really face the most challenges. So I really want to just give a little bit of framing around, some of those numbers, and then sort of return to a little bit of the prospects for the Department of Early Learning and Care. So again, I think these challenges are so big, that I don't want to claim that the creation of Department of Early Learning and Care is a magical solution to these problems, but I want to at least share with you, I think, some of the opportunities that we have as a state agency to partner with communities and providers and families to, help at least start to address some of these challenges. This is just a little bit of an overview of the various programs that Department of Early Learning and Care will administer. Most of these are currently administered by the Early Learning Division, employment-related daycare, and I'm going to return to that as the biggest exception. That's currently in the Oregon Department of Human Services, but will be moving to Department of Early Learning and Care July 1st, right? So, I think the goal of our work with these publicly funded programs is to address that issues of affordability for families. We know families can't afford care, to support learning and development within these programs, and also to support families. And I think that's just sort of true of all of these different programs. I'm not going to go through each program by name and explain what it does, but I just wanted to give you a sense of the variety of the programs that we publicly fund, the age groups that they serve. You can see, both some that are really focused on infants and toddlers, and others that also extend to school age care. But I think that at least gives you some of the breadth. So, some of this is really center-based care. Some of this is also home visiting programs like Healthy Families Oregon, where there's really an opportunity to go to support the parents of young children, go into the home and provide those kind of supports, and also connect them to other services. Yeah, and what I also do want to also emphasize, though, is for so many of these programs that are publicly funded is really still with that mixed delivery model, right? So just take Preschool Promise as an example, right? Some of the Preschool Promise sites that we fund are in schools, but a lot of them are also in Head Start programs and mom and pop childcare centers and also family childcare homes. But one of the other big functions that the Early Learning Division currently has, and that will also be part of the Department of Early Learning and Care, is that we are responsible for the licensing and regulation of childcare providers across the state. Right, there's a really significant function here to ensure the health and safety of children. Right, and so we have a responsibility that when a parent takes their child to a licensed childcare facility, that they, have some guarantee that those health and safety standards are being met by that program. But at the same time that we have that real responsibility for parents and secure and ensuring the health and safety of children, I think we really have an opportunities to make sure we're doing that in a way that's supportive and cooperative with childcare providers. If our director of Office of Childcare, Alicia Gardner, was here today, I think she could talk about this with just even a lot more, in a lot more articulate way than I can. But I think the example that she always sort of gives of sort of thinking about how our licensing rules work and how do we make them work really in the context of real life. She always gives examples of, we do have licensing regulations that plastic bags need to be locked away. They are major health and safety, can be a major health and safety risk for a child, but how, as a licensing and regulatory agency, do we recognize that there's a different kind of risk if you see a plastic bag on a floor with toddlers in the room versus a school-age classroom and the plastic bags are 10 feet up on a shelf? It's not the same situation. And so, how do we think about the work of our licensing regulation to think about those kinds of real world differences and really work in a supportive way with providers? So I think this is just, I want to talk about this, so I think this is work that will be ongoing. That team has been really working on a major overhaul of licensing rules, and we'll be working with our Early Learning Council to pass new center rules in June, and then we'll also be looking at family childcare rules in the fall. And then I also want to talk a little bit about the employment-related daycare program. This is the largest sort of direct assistance program for families to offset the cost of childcare. So employment-related daycare works a little bit differently than the other publicly funded programs I was talking about before. So with employment-related daycare, family enrolls and will continue to enroll through the one eligibility system. So it's the same way that a family can access SNAP or other public benefits. Then the family chooses the childcare provider that most meets their needs, and then the state will then pays the childcare provider directly. There's still a copay for the family, but this is a major program that will be shifting to the Department of Early Learning and Care. And I think, adding that to that shared portfolio really also gives us just new policy tools to think about how do we use this as an opportunity to think about supply building, in other parts, childcare supply building in other parts of the system. Just to give you a little bit of a sense of employment-related daycare, currently serving about 9,000 families with over 17,000 children. We work with about 3,000 providers. Average cost per case per month is about $1,500. Families do have a copay. We've been able to greatly reduce that copay over the last couple of years. So you see the average family copay is now closer to about $15. It was greatly reduced from what it was in the past. This is a program where, also as part of House Bill 3073 that created Department of Early Learning and Care, there has been some changes to the policies to really help make it work better both for families and providers. As of January of this year, full-time students are also now eligible to participate in employment-related daycare. change the hours of authorization. So families now get part-time or full-time childcare hour authorization, which is much more generous than it was before. And then in July of this year, we're going to be moving to a stronger 12-month protected eligibility, so that if a family loses their employment, they don't lose access to that child care assistance. And we'll also be integrating child care support for families on TANF into employment-related daycare starting July 1 of this year. We're also working to allow children who are undocumented to participate in employment-related daycare, with tentative date for that one on spring of 2024 for implementation. So anyways, I just wanted to share some of the work that's going on, with the new Department of Early Learning Care and some of the prospects for the future. So thank you very much.
Thank you, David. It's encouraging to see all the good stuff that's going on with your organization. So thank you. Lastly, we'll hear from Claire Berger. Claire is chair of the Public Policy Committee for the American Association of University Women of Oregon. Claire's career is centered around three major areas: childcare administration, workforce and economic development, and migrant Head Start administration. She administered a childcare nonprofit in Washington County that included childcare centers, information and referral services, registration and training of family daycare providers, and migrant Head Start program for children ages 6 weeks up to 5 years old. She also was director of an after-school program for 6 to 12-year-olds. Claire will tell us a little bit about bills that are currently in the Oregon legislature that could impact childcare. Welcome, Claire.
There. Well, I don't have any slides. You'll have to listen to me and look at my face as I go back and forth on my notes. I thank you so much for this time to talk with you. There's been a lot that's been going on, and I think what I'll be talking about are the bills that speak to childcare and outside school time. They're both kind of inextricably entwined as a continuum of care for families. And so I think it's really important to be looking at the full continuum and what we can do to help shore it up. It's interesting that I think David was talking about the disinvestment in childcare. And I remember in the mid-60s and early 70s, the federal government as well as the state had really done quite a bit of investment in this kind of thing, both in outside school time as well as childcare. And it was a very different time, and I'm looking forward to seeing us kind of move in that direction again, so that we can actually see some improvement in all those areas. I think that I think that the other three speakers talked a lot about the childcare deserts, about issues around infant care, and that's always been a very difficult issue, difficult to find people to do that. What I think has been found is that there's a definite lack of staffing due to low wages, a lack of facilities, and a lack of really good information and data. And what I want to talk about are the bills that are actually, we think, are going to kind of affect those specific areas in this particular legislative session. There are many bills that have been presented in the legislative session on researching childcare issues and developing state infrastructure to support recommendations for improvement. That's something, there's a tremendous amount on all agencies are looking at that and how they can cooperate together. I'll not be talking about the research and study bills, but I'll focus on those bills that impact more immediately the availability of childcare in the state. In addition, the following bills are being reviewed now in legislative committee work sessions, so changes are being made to their content. My summaries are going to be very general and may not represent how the bills will look at the end of the legislature. We all know during the session that it looks like a bill looks one way when it starts, but as we move forward, it changes. There are 3 childcare bills that I wanted to bring up that were kind of pieces of some of the problems that were brought up earlier by earlier speakers. House Bill 3005 deals with what's been talked about with the lack of childcare infrastructure and facilities. It's a bill that would pay for property acquisition. It would pay for repairs, improvements, consultants. And this, when we're talking about family childcare providers, they really make up the bulk of childcare SWATs in this state, actually everywhere. And they also have access to this funding. So if they were looking at going from a small childcare program to maybe a group program where they have more children in there, they would have access to this funding to help them ramp up their facilities and make sure, basic business practices. This particular bill really does prioritize those populations like low income and those historically not served typically. So we're talking about targeting people from the Native American community and also from communities of color. So there will be, they are looking at this as a funding bill, but they will be prioritizing that in that way. Another one is House Bill 3029. Now see, okay, so the 3005 dealt with facilities, right? 3029 is a provider incentive program, which is kind of cool. And Julie, you were talking about that, working with providers, getting people to actually provide care, looking at childcare staffing. Now, what this is interesting is it looks at attracting and maintaining a sustainable, educated workforce. And it will be both working in childcare facilities and homes. And again, I want to say homes are the ones where we have the bulk of the childcare slots. This includes, and what this will do is this would provide support for those people wanting to go into these jobs. So we're talking about education scholarships potentially. We're talking about maybe a loan repayment having to do with education, and even some childcare housing for them. So this is again dealing then with the worker side. So here's these 2 pieces that tend to be a real difficult issue. The third one, which I think is really interesting, is it's Senate Bill 599A. And Julie, I want to talk to you about this. This deals with childcare in rental properties and apartments. Now, I remember a long time ago when I was messing around with this kind of thing, is that they have a lot of people with children living in apartment buildings, okay? And that was a really good way to have maybe 2 or 3 of these families that were willing to be family childcare providers, and they were there, and the families were there that they could take as clients. This one is kind of cool because it would be a little easier for people to actually do this kind of thing in rental properties and apartments, which would be kind of cool. Yeah, the landlords would probably need to require liability insurance. And again, it speaks to both the facility and the workforce, which is kind of interesting to look at. As I was saying, childcare in homes has been used most often by parents. It's considered the oldest occupation, I understand, and far more than in childcare centers. I mean, at one time it was thought that about 75% of all childcare was done in homes. Julie, do you think that's probably about where you're thinking about too?
I know in Douglas County, the majority of our care is done in homes,
Right.
by both licensed and the exempt programs, because I
Yes.
think we only have 5 centers, or what we call centers.
Okay. Right. They're a lot more expensive to renovate and keep. And it's a lot easier in a family childcare provider situation, particularly for infants and toddlers, where you want them in places where there are fewer kids, perhaps, and in a different environment. So, so this is interesting. These are real specific kinds of bills that have been getting a pretty good amount of support by both entrepreneurs who want to develop childcare networks, but also family daycare providers, because there's an issue around that. So those are three of the primary childcare bills that have come up that really seem to have some weight to them in terms of what we know is a reality about childcare. Now, what's interesting is there's a bill out now, and I'm going to switch to the outside school time. Used to be the old latchkey programs, which is an old name for them, and the outside school time programs have probably around the same problem, I think, as the early childhood in this, and it's very difficult. They used to be done in schools for after school, before and after school, and there's been some liability issues around that. So it's going to be interesting to see how that's worked. This particular bill is Senate Bill 858, and this one does not talk about, more staff or facilities. What it talks about is establishing a new type of district. Okay, it's called a Children's Services District. Now, Julie, you've already got one, or one close to it. You've pulled together within your community something that works really well for you. You've pulled everybody in. The bill allows Oregonians the right to collect signatures to put an initiative on the ballot for voters to determine if their community supports the formation of one of these things. Okay, and the Children's Services District can be really pretty broad. The community, it doesn't ask for any money, okay? It can be really broadly defined and include any services that best meet the needs of children outside of school hours, although there's no reason why you also couldn't look at early childhood as well and kind of pull them in together into one major issue. Now, it's very focused on a specific district. So it depends on, what this district looks like, what kind of childcare they need, and that kind of thing. And what they're talking about with this is the ability then to collect signatures to put it on the ballot in their district. The examples of this may be after school and summer programs, early childhood programs, including arts and music, technology, and any other kind of health and well-being kinds of things. And so these would be for kids, you'd probably look at 6 weeks on up to 12 or 13 or whatever. The establishment of a children's services district, according to this particular bill, must include filing a petition to form the district in a county, including a proposed rate limit for operating taxes to support the services. Okay, that's one thing. The second is it must be signed by either 10% of registered voters or 100 registered votes, whichever is greater. And then if enough signatures are collected, the petition is voted on by all the registered voters within the district boundary. So if the petition passes, the district is formed, and then they can start deciding what's the mosaic of this. What are we going to be doing with? What are the major issues that need to be confronted in this particular area for childcare and out of school care? Now, I wanted to tell you, I had a lot of pre-bill remarks, but you guys already had them. So I'm not going to say them again. So my major issue again was in the bills, and these are only 4 bills I pulled out. And the reason I did that, there are so many research and studies out there where I was focusing in on how do they deal with 2 major issues which we notice are a problem, and that is low wages, access to staffing, and also lack of facilities. So thank you. And that is the end of mine.
Thank you, Claire. This is very helpful. I took lots of notes on this one for sure.
Oh, good, good. Thank you.
Now let's shift gears a little bit now and address some of the questions some of our viewers may have. Kathleen, what questions do we have from our audience?
Well, the first one, and I'm not sure who wants to address it, is what is the definition of quality childcare?
Oh, man.
Well, I think that was asked during my presentation, so I'll take an initial stab at it. And then, David, I'm going to put you on the hot seat to talk about what the state considers as quality. But for us, we look at the intellectually stimulating environments. We think that those are important. Like the days of sitting kids down in front of a TV are long gone. So we're talking about real educational experiences where they, can go outside and play and, look at the ants running across the ground and then have somebody explain what they're doing and why they're there. Being inside, working with toys that are educationally appropriate, age appropriate, making sure that they're also safe, but the nurturing environment that are developmentally age appropriate, positive, a diverse learning environment with appropriate learning opportunities. The physical environment is extremely important to stimulate learning with spaces that are designed for those kids. The other thing I would say that's really critical are the nurturing relationships with trained staff and providers. And the retention of that staff is really pretty critical because those little gomers, they get attached to their teachers or their providers or their childcare provider. Parental involvement, and then of course a safe and secure environment. Nutrition is also an important key. We're not going to stuff candy down them every day. We have to make sure that while they're there, they're getting good, appropriate nutrition. So I think, David, you might be able to address what the state feels, or what I shouldn't say feel, but what's in rule or what's in regulation.
Yeah, no, thank you, Martha. And I don't think I really have actually too much more to add than what Martha said. I mean, I think everything points to that the most important support for child development is, warm, nurturing relationships between young children and adults, and the quality of those relationships is really, that most important dimension. There's lots of things that go into establishing the conditions, for that to happen, including, those adults, have the training and support so that they understand child development and where a child is at and what's appropriate behavior at particular ages, but also, as Martha was talking about, how you set up environments that support those kind of interactions between the adults, but also other children, right? And all those things I think are what we really mean by quality, in addition to also making sure that the basic health and safety of children is really being protected in those settings.
Yeah, and I'll just add what we have focused on as we've created awareness in our community is that it's not just babysitting. It's not just you're sitting there, making sure the child's safe and has food, but that it is from an early age that getting ready for kindergarten. It starts, at that early age. And so that's where we really see that. What is the socio-emotional readiness? What is alongside the academic? And how are you playing with them and engaging them appropriately to get them ready for kindergarten?
I think I'll add one thing. I think, Julie, you kind of clicked my brain going here. Most of child development or brain development is done before age 5. And so we need to stimulate that brain development. We need to make sure it's appropriate, because if we don't, then we're going to have a lot more costs and problems further down when they're in school. So that 70 to 90% of brain development done between 3 and 5 years old is really a pretty critical time to make sure that we're working with kids as far as getting them up and running.
Sort of a continuation of that. We've heard a lot about mental health problems by the time you get to teenage. Does anybody have some statistics or some background on how good quality childcare sets children up to avoid these mental health problems?
Could
I-
I?
Yeah.
Oh,
Go ahead.
sorry. No,
No,
you
go-
go
go-
ahead. You go ahead. You go ahead.
So I had actually two sort of different directions I wanted to go simultaneously on this. One is, I think really an important also story is the mental health of the folks doing the work in childcare. I don't have the numbers right in front of me, but we partnered with researchers at PSU to work on surveys of childcare providers, and the percentage of childcare providers self-reporting signs of high stress, or symptoms associated with depression was really remarkably high. I think what we're also hearing is that the stress that families are experiencing and that were heightened during the pandemic, childcare providers experience that family stress, and that's a source of stress for them. So I think one part of this conversation is also how are we supporting the well-being more generally of childcare providers, but also mental health of childcare providers. One of the other issues that we know is a really important issue in early childhood is suspension and expulsion in early childhood settings. So we know that happens too frequently at an early age. That can be really traumatic for children. And so one of the things that we're working on, and actually this is a result of legislation from some previous legislative sessions, is supports for providers with the goal of reducing suspension and expulsion, which we also know impacts children of color, children with special needs, even more highly. And that part of, it's not the only solution, but part of is that the strategy is making sure that providers have the tools so they understand what appropriate behavior is, so that if they are seeing behavior that they're experiencing as challenging behavior, they know how to work with the child. And so I think it's not directly answering your question, but I do think that is in the long run about supporting the mental health of young children as well.
And that leads right into another question, and we've addressed it a little bit. Claire said they're looking at it in the legislature. Education, basic education for providers, continuing education for providers, expanding the support system for providing that kind of education. Where are we going with that?
Well, I know, having worked with Heather, who is our childcare resource and referral director, there is a tremendous amount of education that is provided through the local CCR&Rs to the providers. And I think it also has a lot of that self-care, self-regulation offerings as well. I know locally for our region, which is Douglas, Klamath, and Lake County, they are probably offering, monthly 2 to 3 things for people to get those ongoing credits. And there is a lot of great work being done in partnership with CCR&Rs and the local community colleges, and great programs there. So there is really extensive requirements to be a childcare provider, and then that ongoing education that occurs.
Is there charges for that kind of thing, or is that offered for free? Is it easily accessible? I mean, if you're working a 40-hour week, is it easily
They
accessible?
do make it accessible in the evenings, the ongoing. And I know with our local Qual Community College and the support that people entering that field, that they can almost get that education for free. There are so many scholarships and things that are being offered that there is really no cost.
Could excuse me, can I say something here, Kathleen? Julie brings up a good point. She has a system set up, and her system is one that has access to different resources, to different kinds of things. And in the past, the CCRs have been, we used to have a full network of those all across the state that actually reached out to the family child care providers in the homes and brought them out to do, I remember doing trainings for them. There's no longer, that I understand, and help me on this, Julie, there's no longer this system across the state. Some have, am I totally crazy about this? Where that the CCRs are some areas don't have them, I don't think, do they?
I think maybe David can answer that. I thought all regions had them.
Okay.
And there is still that network. They meet regularly. And they really provide technical assistance and education to providers. They help them get up and running. They connect them to licensing.
Excellent.
And they do that education.
Excellent.
So it's a very strong system. It didn't go away.
Still running then. That's
wonderful.
That's wonderful. Excellent. Thank you.
How are we doing on time? We have one question for David. Is the state looking to address those middle income groups that are currently being left out of programs like Baby and Preschool Promise? For reference, I make over the threshold for Preschool Promise, but also can't afford full-time childcare for my now toddler.
Yeah, no, I think that's a really good question. And, part of the answer is that we're only able to sort of work with the resources that were given by the legislature. Employment-related daycare now goes up to about 200% of the federal poverty line, and we know that families, above 200% are also struggling with the affordability of childcare. But we also know that only about 17% of the eligible families, for employment-related daycare, are accessing that program. So I think the challenge is, we know that there's also a lot of need for families above the income thresholds that we're reaching, but we also know that we're still not reaching a lot of the families even within those income thresholds. And so I think that's the sort of challenge of the moment.
David, what is the Preschool Promise eligibility? Because I felt like it was higher than 200%, but maybe
Preschool Promise is also 200%.
Okay.
Yeah.
I was thinking somewhere was 400%, but that might have been in another state that I was researching. And so that's where I think I was getting myself confused. That is something we commonly hear in our county as well. We did a combined block grant to get subsidies for parents, and we can't find the parents that meet the qualifications. They're not reaching out. And so we have this money sitting on the table that the coalition supported getting, and we don't know how to get it out to families. And it's that next tier are really struggling. And as a woman who now has grown children, I was a single mom with 3 children, and I paid a lot of childcare back in the day. And it was tough even when I had a good, job. And so I feel the pain of our families who aren't in that one threshold, but aren't in that next, you're in this in between. And I think we need to hopefully see that starting to get addressed, across the board.
All right, that takes care of the questions that I have received. Thank you.
Kathleen, there was one left in there, and I don't know if we answered it, that Barbara asked, which was licensing. Will it include education programs for childcare workers, and our programs for educating workers expanding? And is there going to be support for expanding those programs? I think that's a David question, but I'll just say yes.
And I'm not sure, to be honest, I caught all of that to actually answer the question.
I think basically what she's asking is that on our licensing, will there be education for childcare workers? Are there funds, and are programs for educating workers expanding?
Yeah, and I realize we're kind of coming to us. I'll try to give a very brief answer to that. So, you know, we actually have seen really over the last 4 years significant state investments in supporting early learning professional development. That particularly happened with the passage of the Student Success Act. It was really the first time that we saw state dollars. So previously, our entire R&R Child Care Resources Referral System, that was all federal dollars that goes into it. And so we have been sort of actively working with our higher education partners, the R&Rs, to start to try to build out the professional learning system. There's a lot of work still to be done, still very early in the early stages, but I think also an emphasis on what people now refer to as job embedded professional development. So in addition to training and credentialing, what's the opportunities to provide coaching, insight to really support people in their professional growth. So sorry, that was a very quick answer to what's really could be a full evening question.
And another question came in. We have a center-based preschool and after-school program in Multnomah County and are now providing preschool for all. Preschool for all has made significant strides in paying staff living wages. That said, we can't pay our after-school staff anywhere near those rates. Are there conversations about wage equity taking place?
I can answer some of that, not all of it. So for some of the areas that I'm doing advocacy work down in Salem, we are working on pay parity, especially in the prenatal to age 5 area. I know that the Oregon After School Coalition, they're trying to work on that too. I don't know exactly what they're doing, and I don't know exactly where it stands in the legislature, but overall, we're trying to move that level up so that there's a livable wage and that there is pay parity for jobs across the board. So whoever's asking that question, we're working on it. It's a work in progress, and we just need to keep getting after it.
Thank you all. It's been very enlightening.
Very much so. Thank you, Kathleen. Thank you to all of our panelists and to you, our audience, for your really great questions. We hope you'll continue your interest in this important issue and continue to follow progress at the state, national, and local levels. I'll turn things back over to Becky now for her closing remarks.
Thank you. Thank you to our excellent speakers for this insightful and informative discussion. We appreciate the work you do for childcare in Oregon. And thank you to our audience for joining in and adding questions to further the discussion. Our website is LWVOR.org, and a recording of this program will be available there. You can read our report, Caring for Our Children, under Studies, and subscribe in our newsroom for newsletters, including our current legislative reports. The League is a membership organization open to all, age 16 and over, so look on our website under Get Involved to join. On behalf of the League of Women Voters of Oregon, I wish you joy in this springtime of renewal. Thank you and good evening.